My name's Samuel Mbugwa. I'm a lecturer in the Department of Human Nutrition at Egerton University in Kenya.
Yeah. I am Ambrose Akilo. I'm a lecturer in the Department of Demography and Social Statistics in Obafemi Awolowo University in Nigeria.
My name is Penina Masibo. I'm a nutritionist by training, and I work for Moi University, which is a public university in Kenya, where I teach nutrition at the School of Public Health.
Yeah, what did I learn from the DHS program or fellowship program? I did learn quite a lot, and I think the most striking lesson was being able to interact with the data whose findings I've come across in the course of my training and practice as a nutritionist. And above all, the whole idea of working with complex survey data from the basics to the modeling bits was quite interesting and an eye-opener to me. So that eventually, in terms of working on our working paper and eventually publishing the paper, was quite an addition in terms of knowledge learned and competencies gained.
Although I have used DHS data, but my knowledge, I will admit, is not at the level that it is now as a result of my participation in the program. I wanted to know more about the analysis and also to be able to teach it effectively as a lecturer. We learned about the analysis of DHS data. We were taught about the data structures, the different files, and which data to use for different analysis, and more importantly too, the concept of weighting in a survey analysis. So we were taught about all those ones.
And my experience with DHS was wonderful, I would say, because I learned a lot of data analysis skills, and I was also able to interact with very well trained people at DHS who were able to train me and to build my capacity. And I would say it was a very good experience and a training that really enhanced my skills in data handling. Yes, after my training as a DHS fellow, I realized the much potential there is in DHS data, the volume of data there is, and the volume of research that people can be able to do with good quality data. So after that, I talked to my colleagues, whom I encouraged to be able to participate in, to generally create awareness in DHS and for them to be able to participate. And in the following year, after my fellowship program, so my colleagues were able to apply and also be recruited as fellows for the following year. But also in terms of sharing the research findings that I have been able to do using the DHS data, both my DHS 2011 paper and other papers that I've been able to work with. I've also been able to collaborate with colleagues in publishing out of the DHS work. And besides sensitizing my colleagues on the availability of DHS data, I am also able to share that information with my students and to make them aware of the availability of DHS data and the usefulness of DHS data in research.
So after our particular fellowship, we organized a two-day workshop for academic staff of the department, of the Faculty of Social Sciences and Community Health, Department of Community Health in particular. We had that two-day workshop and it was well attended, but then we realized we could not accomplish much during that period, and this motivated us to organize a week-long workshop, which we did in February this year. But apart from that, we have integrated the DHS into our academic curriculum in the university and the Department of Demography and Social Statistics. And in addition to that, we also have periodic seminars, during postgraduate seminars, where we talk about DHS data.
In terms of capacity building, besides creating awareness and sensitization on the existence and opportunities in the use of DHS data reanalysis, I've been able to organize 2 Write Shop activities for faculty and graduate students, and currently we are fine-tuning our first drafts of the papers based on diverse topics ranging from maternal nutrition, child nutrition, as well as HIV and diarrhea. And so DHS has really come in handy, considering we are in the process of reviewing our curriculum as well, and so we have been able, together with other colleagues who attended the DHS curriculum, to mainstream DHS, especially the experiences, lessons and resources available from DHS in some of our courses, especially those related to research methods, biostatistics, as well as outreach activities.